All right, Dr. Emer, we're live.
Hey you guys, it's Dr. Emer. So many of you were writing us last night about how we were doing liposuction at such a thin patient. And you guys know we specialize in doing athletic shaping. And one of the things that I've always done ever since I was starting my practice was doing fine contouring and sculpting. And my patient here is not overweight, but she wanted a little more definition. And we wanted to use some of the fat, if any, to be able to give a little more shaping to her buttock area. And here we are at day one, and you can already see in such a thin patient the lines that are starting to develop. Look before on here, we really didn't have any of those lateral lines or central line, but now you can see that it's starting to form. The other thing was she also had like a little bit at the bottom that we did a lot of Renuvion internal heating to tighten this area. Actually, some of the sort of redness that's in here is the internal swelling from the Renuvion, and that causes tightening over time. The other really amazing thing is look at her waist and the curve. Even somebody this thin, we're along the ribs, and we're really giving that sculpted look so she has more of an hourglass shape. And then the other thing was, I'm gonna have you turn because so many women were asking about this, was this area here in her buttock, we did some tightening. Now, I want to show you guys here, you can see when we zoom in, there's a little bit of looseness down here. And what we did was we did body tight all through here to kind of contract the tissue. Right now you will not be able to see the result of that. It'll take 3 to 6 months for us to see. But all the fat that we got, we were able to place right here to lift this up. So you can already see, look at how much lower it was here, the distance, and now look, it's rounded from the side. If I have her turn just a little to the right, there you go. Look at the roundness now. It's much more of a curve versus an angle. And so she definitely has a nice kind of sculpted look. We call this the slim model lipo because she's very, very lean. And the goal here was tightening. You can even see if we turn you left, look here you guys, look at her waist, super slim. Very, very, very tight. This is going to be sculpted. We removed fat in the upper back, lower back, and also the stomach to really give her a look, a big look, a good look. And this area here, we did a lot of heating right through here so that this kind of natural crease that people have goes away. It improves. What are they saying over there? All right, I'm going to turn you back.
So since she needs to go through the healing process some more, yes, guys, she's just 1 day after surgery. You can see part of her surgery on our IGTV and our YouTube.
And if you
right
see,
now,
if I turn right, like this, you can see the shadowing, you guys, of these little lines. Let me turn a little left, right there. Got it. And if you see the shadowing of those lines and the sculpting. So that's really what the Vaser high def supermodel lipo can do. The issue is most doctors leave a lot of irregularities, find cannula lines, discoloration because they're not very thorough at that superficial level. And for her, we had to be really, really thorough and use the Renuvion to get the result. So you guys will see it in the next few months. It's really going to tighten up. I'm very happy.
Are the buttocks real or actually augmented?
Well, we did the fat.
Guys, we did a fat transfer, guys.
She naturally is athletic and slim. That was her natural buttock, but we used some of the fat to sculpt out the bottom. She looks great. All right, so that's it. That's torso with the sculpting, the heating, and a little bit of fat on the buttock roll with the body tight. Complex, more technical surgery, but a great result even at day one. So stay tuned for her healing. Bye, guys. Cool. Yeah, it looks great. Now